And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Hello and welcome to Dead Doctors Don't Lie. This is Dr. Joel Wallach, your host, a veterinarian and physician. I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative, and a lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, if you have a health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free at 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. I want to talk about celiac disease today. This is a disease that was once the sort of disease of infants. Kind of not a lot of known about it other than there was a gluten intolerance, which led to zinc deficiencies and all kinds of problems. And the celiac disease resulted in restricted growth and so on. And they figured out some 100 years ago that it was due to a intolerance, not an allergy to, but an intolerance of gluten found in wheat, barley, rye, and oats. And so the cure, so to speak, was to get these kids who are in trouble, struggling with constipation and diarrhea and slow growth and all kinds of behavioral and physical problems, was to get them off of wheat, barley, rye, and oats and have them eat rice. During the 60s, it was called the macrobiotic diet, where people ate vegetables and rice and fish, and things miraculously got better. The main thing is there was no magic in brown rice. Sometimes the macrobiotic diet was called the brown rice diet. But there was not any magic in brown rice. It was just the fact that they stopped eating wheat, barley, rye, and oats. Well, the rate of celiac disease has gone up dramatically. It used to be like 1 in a couple 100,000, wasn't a big deal. Research from the Mayo Clinic, the leader of the study says, it could be as many as 30 out of 100 could have celiac disease. And I believe in some communities where there's a powerful doctor who says, don't use salt. Restrict salt, and people listen to them, and they restrict salt. Their chief cells in their stomach can't make stomach acid, and they have a very difficult time in breaking down wheat, barley, rye, and oat proteins to their simplest amino acids. And the women, in particular, get sensitized to glutens, wheat, barley, rye, and oats. They pass this on either through the cord blood to the infant and or breast milk to the infant, and the baby then is colicky. You've heard of colicky babies, and then they put babies on soy milk or rice milk, which is the worst possible thing because nutritionally, soy milk and rice milk have nothing to do with milk. But on the other hand, they're also being sensitized just for trying to breastfeed them for 2 weeks, sensitizes them to wheat, barley, rye, and oat glutens, and they become gluten intolerant. Then studies show that, you could be 50, 60 years of age and be able to eat all the wheat you want and all the barley, rye, and oats you want, no problem. But suddenly in your 60s and 70s, you should develop celiac disease. Well, that's because, again, restricted salt, not enough stomach acid, can't digest wheat proteins. And it's a progressive thing. When you're a little kid, just 1% of your intestine afflicted. As you're in your teenager, you might be 20% afflicted. Then when you're in your young adult in your 20s, you're going to have 25 to 50% of your intestines afflicted. You start getting a lot of diseases because most diseases are nutritional deficiencies. You can't absorb nutrients. People who say, I can take 10 aspirin, it won't hurt this headache, it won't stop this headache. I can take 10 aspirins every hour and this headache won't go away. And that's because they can't absorb the aspirin because of celiac disease. Now, as celiac disease gets worse, it's called irritable bowel syndrome. People get constipated with diarrhea alternating, then that develops into inflammatory bowel disease, and sometimes they'll use antibiotics to knock down the bacterial load to relieve symptoms, but doesn't solve the problem unless they get off of wheat, barley, rye, and oat gluten. Then it progresses to ulcerative colitis. This can be in kids, and they get appendicitis, and adults will get diverticulitis. These are all symptoms of celiac disease, irritable bowel syndrome, inflammatory bowel disease, and Crohn's disease in the most advanced stages. And the surgical removal of your intestines is the doctor's choice for Crohn's disease. There's a lot of abdominal pain. A lot of times they'll take out your gallbladder, and you'll still have abdominal pain because it wasn't a gallbladder, it was celiac disease. They You'll take out your intestines because you're in Crohn's disease. They make things worse because why would you take out somebody's intestines when they have an absorption problem? Well, that's the medical system for you. Well, all you have to do is get off of wheat, barley, rye, and oats. I'm going to repeat that. When you have celiac disease, irritable bowel syndrome, inflammatory bowel disease, when you have ulcerative colitis and Crohn's disease, all you have to do is get off of wheat, barley, rye, and oats. And that includes beer, scotch, and bourbon. That includes croutons, crackers, buns, bread, muffins, pasta. And in spiritually advanced cultures, and I'm talking about the yogi type of spiritually advanced cultures where everybody's eating whole grains, they may have as many as 80 out of 100 in that community, whether it's a church community or a lifestyle community. They might have as many as 80 out of 100 have one of these stages of celiac disease. Again, celiac disease, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, Crohn's disease. And what we like to do, and people have these problems, and they'll have asthma, and they'll have dermatitis, eczema, because it's just a shame, it's a crime that a dermatologist, when somebody has celiac disease, will give them a cortisone cream to rub on the skin. When you have asthma, they'll give you inhalers, and all you have to do is get off of wheat, barley, rye, and oats. No wheat, barley, rye, and oats in any form. No kashi, no granola. Yep, even things you think of as being healthy. When you have a gluten intolerance, you cannot eat any of that stuff. You take the 90 essential nutrients, something like the Healthy Starter Pack, and some extra antioxidants, such as our selenium, the Cell Shield RTQ, OPCTs, juice, Beyond Juice, and some of our super juices, such as Noni, Z Radical, O Radical, all this kind of stuff. And these diseases just go away. The dietary restriction of gluten will make these diseases go away. You see benefits sometimes as quickly as 3 to 7 days. Within 3 to 7 days, you can see benefits. Certainly, in 3 months, you're a new person. Contact your Youngevity associate. Get that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with celiac disease, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, and Crohn's disease with diet and supplements. What a concept. We'll be back after these messages.
If you'd like to learn more about nutritional supplementation, call your local Youngevity associate. And don't forget to ask about home-based business opportunities.
Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk about a CNN headline story where the headline is Antibiotic May Ease Irritable Bowel Syndrome. And this was all published, a study in the New England Journal of Medicine, and it was a study done to about 1,200 irritable bowel syndrome patients, and what they did was they gave them an antibiotic, rifaximin, and it is a drug that's not been approved by the FDA, but they're currently looking at doing so. They say 1 in 5 adults in America have IBS, and the lead researcher says he's a Mark Pimentel, a medical doctor, gastroenterologist at the Cedars-Sinai Medical Center. He says it made all the symptoms of irritable bowel syndrome better, and which we don't see very often. And then later in the study, he goes on to say bloating is sometimes thought to be related to bacterial imbalances in the gut, and with antibiotics, a class of drugs that works only against bacteria, this suggests that we've hit upon the cause of IBS. And, of course, they did see that people that took the antibiotic as compared to a placebo, about 40% reported that they got relief from their symptoms such as bloating and abdominal pain and loose stools. But, by the way, the study was funded by the maker of the antibiotic, Salix Pharmaceuticals, so you got to kind of question the outcome here.
Yeah, well, again, the magic words here, Doug, are that this antibiotic relieves symptoms of irritable bowel syndrome. Again, in the monologue, I talked about celiac disease, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, and Crohn's disease, all really different stages of the same disease, a sensitivity to gluten, actually a gluten intolerance of wheat, barley, rye, or oat proteins. And the answer here for irritable bowel syndrome is to eliminate, this is an avoidance program. You have to eliminate all wheat, barley, rye, and oats. There's no exception. This is a lifelong problem. At least at this time, there's no technology to deal with it. And so it's a lifelong avoidance of wheat, barley, rye, or oats. And if they do that, they will add 25 to 50 healthful years to their life. If they throw in all the supplements, the Healthy Starter Pack, the 90 essential nutrients, throw in a little bit of extra stuff, we have all kinds of wonderful probiotics And our Triple Treat chocolate has probiotics. Our Nightly Essence has probiotics. And so you can take those supplements, probiotic supplements. To me, the Triple Treat chocolate is the finest one. It's a lot of fun. Has 16,936 ORAC points per piece, the size of a pat of butter. It's glycemic friendly, can be used by diabetics. It's gluten-free, so it's great for people with celiac disease, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, and Crohn's disease. And if anybody has any questions before you start letting them do surgery on you, cutting your guts out when you have these diseases, contact us right here on Dead Doctors Online. I'll walk you through it, the dietary changes, and the supplement program. Again, the Healthy Starter Pack, which has the Osteovax Plus, the Beyond Tangerine NutriCrystals, and the EFA Pluses. That's going to give you the 90 essential nutrients. You'll be able to more efficiently absorb them simply by the avoidance of wheat, barley, rye, and oat glutens. And that means no breads, muffins, buns, no croutons, crackers, cookies, no pancakes, waffles, no Pillsbury toaster strudels, no Pop-Tarts, no Timmy Hortons, absolutely no Krispy Kreme donuts, no things like Dunkin' Donuts, no pasta, no spaghetti, no ravioli, mustacholi, none of the olis, absolutely nothing that's made from wheat, barley, rye, and oats. And that includes beer, scotch, and bourbon. Wow. Thank you for bringing that one up. That's my current favorite subject. I'll be back.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area.
Okay, Doug, let's go to callers.
Let's head to Toronto, Canada, and Nelson, you're on with Dr. Wallach.
Hello, Nelson, you're on the air.
Yes, sir. On the air, right?
Yes.
Hello?
Hello, Nelson.
Yes, fine.
How can I help you?
Well, I call your station because I have a problem with my knee.
Okay.
Scheduled for operation on April.
Is this arthritis?
Yeah, arthritis. It's severe arthritis.
Okay. How old are you?
63 and a half, something like that.
Okay. And how much do you weigh?
160 to 165 pounds.
Okay. Now, have you tried your free healthcare system, Health Canada? What did they do for you?
Healthcare. Now I'm have a Tylenol 3 for my pain reliever.
Okay, so they gave you some pain medicine for your knee, correct?
But it doesn't work anymore because...
It doesn't work. Okay, good. Well, I know that. I'm just wanting everybody to hear that. Okay, did you say something about your liver?
Doctor?
Did you say anything about your liver?
X-ray. And then when I went to my doctor in my knee, he told me that I have no more cartilage.
Okay, good. Okay, that tells me what I need to know. So what I want you to do is listen here, and I will give you a program to support and promote. I can legally say support and promote healthy maintenance and repair of cartilage, which includes cartilage in your knees, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. Now, here we go. At 160 pounds, what I want you to do is take 2 scoops of the Beyond Tangerine NutriCrystals at breakfast with 8 ounces of water. I want you to take 2 scoops of the Beyond Tangerine NutriCrystals and 8 ounces of water with dinner. And this will give you 130 nutrients, vitamins, minerals, amino acids. It will give you 115 berries, fruits, and vegetables. That'll be 2 canisters per month. I want you to take 1 ounce twice a day, 1 ounce at breakfast, 1 ounce at dinner. That's 2 quarts a month of our liquid colloidal trace minerals, 77 certified organic minerals. It also includes 1,200 milligrams of a liquid colloidal chelate calcium and 400 international units of vitamin D3. I want you to take 1 ounce at breakfast, 1 ounce at dinner. That'll be 2 quarts per month. The EFAs, the omega-3, 6s, and 9s in proper ratio. I want you to take 3 of the EFA capsules at breakfast, 3 of the EFA capsules at dinner. That'll be 180 count bottles per month. The secret sauce here to rebuilding your knees to support and promote maintenance repair of that cartilage is to take 5 glucogel capsules at breakfast, 5 glucogel capsules at dinner. That'll be 2 240 count bottles of the glucogel per month. Call me every 2 weeks if you would, please, Nelson, and give me a report. We'll be back after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. That does open a line. If you'd like to talk to Dr. Wallach today, call us toll-free at 888-379-2552. That's 888-379-2552. Lines open. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Okay, Doug, let's go to callers.
Let's head to New Jersey. And Janette, you're on with Dr. Wallach.
Hello, Janette, you're on the air.
Hello, Dr. Wallach. How are you?
Fine, thank you. How can I help you?
I am calling regarding my own health and was interested in your program due to my sister being on it and telling me the information.
Okay.
I've
tell me about your health.
I'm sorry?
Tell me about your health.
Okay. Over the last 6 months, I've been experiencing emotional moodiness, frustration, nervousness, anxiety, lack of energy, physically, hair loss. I recently had a miscarriage, eye strain, back pain. So I just thought of calling you and seeing what you could suggest.
Okay. Good. So how old are you, Janette?
I am 43.
All right. And how much do you weigh?
Approximately 155 pounds.
Okay. How tall are you?
5 foot 9 inches.
Okay. All right. Now, do you have any other problems such as diabetes or high blood pressure or dermatitis, eczema, asthma, anything like that?
A slight case of eczema, more so when I was a child than now.
Okay. Do you know if you're breastfed?
I was for 8 months.
Okay. And did you have any respiratory problems, chronic bronchitis, asthma, anything like that?
No.
Do you have a history of constipation or diarrhea?
No.
Okay. Did you have any appendicitis or diverticulitis?
No, never diagnosed. Nope.
Okay. Any diagnosis of thyroid problems?
No, and that was my level TSH was recently checked, and she said it was normal.
Okay. Okay, good. This is all very good. Now, what I want you to do is whip out your pen and paper, and let me ask you one more thing. Remind me about your sister. What did she take our products for? What kind of health problem does she have?
She has varicosities, and she also was suffering with a lot of stress issues, and just lack of energy.
Sure.
What else? I don't know. I can't think of what else.
Sure, I got it. So what I need you to do is give up some things, because it's the way we eat and things we do and don't do that get us in this trouble. None of what you have is genetic. Everything has to do with what you're eating, what you're not eating, and so on. So what I want you to do is give up some things. And these things you give up will be forever. These are drop-dead serious recommendations, and you must give these things up forever, starting with fried foods. No fried foods. Trans fatty acids from the fried foods increase your risk of cancer, directly affect how the brain functions, affects the cell walls of every cell in your body, which then translates to low energy, and blood pressure problems, energy problems, emotional problems, hair loss, you name it. Okay? So, no fried foods. I mean, no fried foods. There's no good exception. No fried rice, no stir fry. I mean, no fried eggs, no chicken fried steak, no fried potatoes, no fried tomatoes, no fried okra, no fried eggplant, no fried chicken, fish, shrimp, nothing fried. I cannot emphasize that enough. Then no processed meats with nitrates and nitrites, no deli slices, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, spam, other canned meats, or hot dogs. Hang on. We'll keep going, Janette, after these messages. And Doug, let's go right back to New Jersey and Janette. Okay. Continuing on the things we need to give up, we already talked about you must give up all fried foods, no processed meats with nitrates, nitrites. I need you to give up all sugar. Sugar is the worst possible substance for your emotions. Sugar problems cause anxiety attacks, depression, bipolar, just about every moodiness, all that kind of stuff. You got to give up all sugar. That means no fruit juices, no dried fruit, no fresh fruit. No agave syrup, maple syrup, no corn syrup, absolutely no molasses, no honey, no table sugar, no soft drinks. You got to give up even the carbonated drinks during meals, because they will neutralize your stomach and reduce your ability to absorb minerals, B12, and reduce your efficiency of digestion of proteins. But all sugar, I mean sugar in cereals, no kashi, no granola, no Pop-Tarts, Pillsbury Toasters, Strudels, no Timmy Hortons, no Krispy Kreme donuts, no Dunkin' Donuts, absolutely no oatmeal, no instant oatmeal, no dry cereals, box cereals, hot cereals, no barbecue sauce, no salad dressings, no mayonnaise, no margarines, no fried food. Give all that stuff up. You're going to be living on rice and sweet potatoes and squash and vegetables and animal proteins such as eggs, red meat, chicken, and fish. You can have butter and water. Those are the only two things you can cook in is butter and water. Then, from a supplement standpoint, for a 155-pound lady, it goes like this. 2 scoops of Beyond Tangerine NutriCrystals and 8 ounces of water with breakfast. 2 scoops of Beyond Tangerine NutriCrystals and 8 ounces of water with dinner. That's 2 canisters per month. That's going to give you, that's going to give you 130 nutrients, vitamins, minerals, amino acids. It'll also give you 115 berries, fruits, and vegetables, sweetened with stevia, not sugar, and there's no preservatives in there. Again, that's 2 canisters per month, 2 scoops twice a day. Then I want you to take 2 ounces a day of the Osteo FX Plus, an ounce at breakfast, an ounce at dinner. That's 2 quarts a month. That will include the 77 certified organic plant minerals and 1,200 milligrams per ounce. So if you're taking 2 ounces a day, as I'm recommending, that's 2,400 milligrams of a usable liquid colloidal chelate calcium and 800 international units of vitamin D3. That'll require 2 quarts per month. I want you to take 3 of the EFAs at breakfast, 3 of the EFAs at dinner. That's 180 count bottle per month. The EFAs, omega-3, 6s, and 9s are required raw material for your brain to make neurotransmitters for cognition, problem solving, emotional stability, and so on. So very important here. Then I want you to take what we call D-stress capsules. The letter D, capital D with a dash in the word stress, D-stress capsules. That's from our Super Life member of our family of companies with longevity. I want you to take 6 of those a day. You can take 3 at breakfast, 3 at dinner. You can take 2 at breakfast, 2 at lunch, 2 at dinner. That'll require 2 bottles a month of the D-stress capsules. And that has mega doses of the vitamins that are necessary for the brain to make its own energy, the brain to function properly, all the neurotransmitters and neurochemicals to work properly and so forth. So you need D-stress capsules 2-3 times a day or 3 twice a day, whichever is more convenient. Then because of the hair loss here, I would have you make sure you're eating animal protein with each meal. The eczema that you say you had, a little bit of eczema, I want you to, this will also result in this hair loss stuff and the emotional stuff. the same principle. I want you to give up all gluten. That means no wheat, barley, rye, or oats. No wheat, barley, rye, or oats. No wheat, barley, rye, or oats. I can't say that enough. And that means no beer, scotch, or bourbon, no kashi or no granola. Again, I mean no wheat, barley, rye, or oats in any way, shape, or form. The quickest thing that will go away is the eczema. The hair loss should slow down and stop. And everything else should move forward in a positive way, because this is designed to support and promote maintenance repair of all tissues, systems, organs, and so on. And I want you to call me every 2 weeks, if you would, Janette, and actually give me a progress or a lack of progress report. Kind of sit down today and make a list of what you mean by emotional moodiness, and what does that mean? Is that 3 minutes a day? Is when you wake up in the morning until you eat? If you miss a meal, do you get sleepy? Do you have noisy joints? Do you have gray hair? All that kind of stuff I want you to write down. Tell me about your energy levels throughout the day, how much sleep, how many hours of sleep you have. Do you have cracked nails? Do you have cracked heels? How many square inches of your body are covered with eczema or dry skin or redness or itchy stuff on your skin? And so you have something to check every 2 weeks. You take a ruler and you say, by golly, I used to have 8-inch circle here, and now it's only 7 1/4 inches. And it's improved 3/4 of an inch. And so these are the sort of things I want to know when you call me in 2 weeks. I want to know your weight. And it wouldn't hurt to take your blood pressure. Go to one of these pharmacies that have a machine. You sit there in the chair and put your arm in the machine, push the button. You get a free blood pressure, free pulse. So if you don't have the instrument at home to do it yourself, you can go to one of these pharmacies or grocery stores that offer that free service. Okay, Doug, let's go to callers, emails, or faxes.
Well, let's head to Austin, Texas. And Jason, you're on with Dr. Wallach.
Hello, Jason, you're on the air.
Hi, Dr. Wallach. Yes. I have pretty severe allergies in general, but right now in Austin we're suffering from cedar fever. And I was wondering if there was anything specifically that I could do.
Okay, cedar fever, is that due to pollen coming out of cedar trees or what?
Right, it's cedar juniper.
Okay. Yeah. All right. Do you have any other problems such as asthma, skin problems, anything like dermatitis, eczema, psoriasis? Do you have any history of constipation? Do you ever have your appendix out? Anything going on?
I've always had allergies. I've been tested when I was young and then about 3 years ago. And I'm actually pretty much allergic to almost everything and food sensitivities and all that. But
you do have some gluten sensitivities?
Some what?
Did you say you had some gluten sensitivities?
Well, food sensitivities, but I think gluten, yes.
Mm-hmm. Okay. And did you, and I may have asked you this, but I'm going to ask you again, do you have any diabetes or high blood pressure? Do you have any noisy joints, like arthritis, poppy knees, or anything like that?
I guess the joints, maybe some popping joints, but that's
okay.
But yeah, no diabetes or anything like that I know of. So.
Well, how old are you, Jason?
I'm almost 43.
Okay. Then how much do you weigh?
Probably about 160 or so, 170. I'm 60.
Yeah, that's close enough. If you, I want to know if you weigh 1 pound, 150 pounds, 300 pounds. Just within the range someplace. And then, what about brothers and sisters? Do you have any brothers and sisters?
No, I guess not. I have an adopted sister, so we have different, health.
Yeah, that wouldn't count. Okay, so tell me about your mom. Does she have any health problems?
Well, she grew up with allergies and asthma, but I guess she outgrew them from what she told me.
Okay.
And I really never have.
Did she breastfeed you?
I don't think so, or not very long. I don't know the specifics on that.
Let's assume the worst here, because we can always back off. I hate to give people advice and it's only partial advice, so I always tend to be a little overzealous. Would be probably the right word here. But I'd rather use a heavy hand than too light a hand, okay? So what I want you to do is give up some things. I want you to give up, because you have a history of allergies, your mom had some asthma when she was a child, she may have breastfed you for a week, or that may or may not be necessary in this case. And so what I want you to do is give up all gluten. Since you have some food allergies, I would give up all gluten. No wheat, barley, rye, or oats. That includes beer, scotch, and bourbon, pasta, breads, muffins, I go out, I go to fast food places, and I eat hamburgers, but I only eat the hamburger and the onions and lettuce and tomatoes and pickles and mustard. I do not eat the buns, the mayonnaise, anything of that nature, because it has all the bad stuff in it, the gluten. And I eat steak, egg, and cheese breakfast, but I don't eat bread or the potatoes, no fried foods, and no gluten. Hang on, we'll come back, Jason, with the rest of the diet, the supplement program for you after these messages.
You may have heard about the 90 essential nutrients or the mighty 90 needed for good health. But with all the products out there, what exactly are they talking about? The Mighty 90 is 16 vitamins, 12 amino acids, 60 plant-derived minerals, and 2 essential fatty acids. So, now you know. But with all the products you see and hear advertised, what exactly do you buy to come up with the Mighty 90 and the right ratios to promote good health? Youngevity has made it easy with the Healthy Start Pack, which contains 1 canister of Beyond Tangy Tangerine Vitamin and Plant-Derived Mineral Complex, 1 bottle of Bone and Joint Enriching OsteoFX Plus, and 1 bottle of EFA Plus Essential Fatty Acids, all in the proper ratios to promote good health and vitality. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Youngevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate. And don't forget to ask about home-based business opportunities.
Doug, we're going right back to Texas and Jason. Okay, so no gluten whatsoever, no wheat, barley, rye, or oats, no fried foods whatsoever. I mean, nothing fried. No processed meats with nitrates and nitrites of any kind. No deli slices, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky. No carbonated drinks during meals because they will neutralize stomach acid and reduce the efficiency of absorption of minerals. B12, reduce the efficiency of digestion of proteins. And then the supplement program goes like this. And this is for all of your stuff. And if you know you have certain food allergies in addition to wheat, barley, rye, and oats, you need to avoid them. That's the only way to deal with it. You need to avoid them. You need to learn how to eat a more restricted diet, which even more requires the need for the supplement program. It goes like this. 2 scoops of Beyond Tangy Tangerine, 8 ounces of water with breakfast. 2 scoops of Beyond Tangy Tangerine, 8 ounces of water with dinner. That's 2 canisters per month. That's 130 vitamins, minerals, and amino acids. 115 berries, fruits, and vegetables in this Beyond Tangy Tangerine, one of the greatest products on the market for health. Then 2 ounces a day of the OsteoFX Plus. That's 2 quarts a month. An ounce of breakfast, ounce of dinner. That's the 77 certified organic plant minerals. It'll give you 2,400 milligrams of a usable liquid colloidal chelate calcium and 800 international units of vitamin D3. Again, an ounce of breakfast, ounce of dinner. That's 2 quarts a month. The EFAs, the omega-3, 6s, and 9s. That'll be 3 at breakfast, 3 at dinner. That'll be 180 count bottle per month. And also, the EFAs support a healthy immune system, support the part of the immune system that fends off allergies, so you might see some benefit there indirectly from supplementation with the EFAs. And then, because you have some joint stuff, I would also throw in what we call glucogel. If you're not allergic to shellfish, you can use our glucogel. A guy your size, it would take 5 of those glucogel capsules twice a day. That's 240 count bottles per month. If you're allergic to shellfish or a vegetarian or have religious beliefs that will not allow you to eat shellfish, we have another way to support remote healthy maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, and that is what we call Fucoid-Z, 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 the letter Z like zebra, 100 milligram capsules, and I need you to take 5 of those twice a day. if you cannot use the shellfish form called glucogel. Fucoid Z is from our Escape, member of our family of companies, and so we're just very, very proud of this product because it's for people who cannot have shellfish or will not eat shellfish for one reason or another. And so it actually comes from a brown marine algae from northern Japan. Japanese have been eating this stuff for thousands of years, and so it's really a great advent to the entire longevity program. And what I would do is have you call me, if you would, please, every 2 weeks, Jason, and that will help me. And you can actually get your mom going on the same program. If you have a brother, you get him going on the same program. Even if, because if she had asthma as a child, had skin problems and all, stuff all her life, then that means that she does have a gluten intolerance, and she can pass it on to the baby through the cord blood and or breastfeeding. Even if it was only for a day, the baby can be sensitized. So that's we're going to go there. Now, I know we only have a moment or two left here, so I'm going to go ahead and take it and remind people that if you want to live chronologically well beyond 100, 110, 120, 130, well, being biologically 30, 40, 50, 60, contact your longevity associate and ask for that book, Immortality by Dr. Milan and myself. It'll teach you how to add these healthful years, the things that you can do to make that happen. It's the book Immortality. And then to your 90 essential nutrients, to your healthy starter pack, to your pig pack, to your pig pack plus, whatever it is you're using to get the 90 essential nutrients, I want you to add to it the Cell Shield RTQ. 2 capsules of the Cell Shield RTQ gives you the same amount of resveratrol as 294 glasses of red wine. I take 6 a day, so I'm getting the resveratrol of 900 glasses of red wine. Cell Shield RTQ. Well, thank you, Doug and Rick. Superlative job as usual. God bless each and every one of you. God bless our troops, and God bless America.